Back. Today I am going to discuss about the sympathetic nerve supply to heart. As previous video we have discussed about parasympathetic nervous system. This is quite opposite to the parasympathetic nervous system. And the sympathetic supply to the heart is mostly to the ventricles and ventricular muscle and little to the atrial nodes and the sinus node. But mostly it supplies to the ventricular musculature and almost all the parts of the heart, but most supply will be the ventricles. So what happens when there is a sympathetic stimulation? There will be increase in cardiac rhythm and conduction. Both the rhythm and means the conduction is increased. Once the conduction is increased, the rate, that is the rhythm, also will be increased. Sympathetic stimulation causes essentially the opposite effects on heart caused by parasympathetic nervous system. Okay, right. So it increases the rate of sinus nodal discharge. So it activates the sinus nodes to discharge more impulses to increase the heartbeat, and to increase the rate of conduction. Okay, it increases the rate of conduction as well as the level of excitability in all portions of the heart. So I have said earlier, the distribution of sympathetic nervous system is all over the heart. So when there is a stimulation of sympathetic nervous system, it increases the rate of conduction as well as excitability in all portions of the heart. It increases greatly the force of contraction of all the cardiac musculature, both atria and ventricle. In short, the sympathetic stimulation increases overall activity of the heart. So what will happen? It increases the force of contraction of all the cardiac musculature, even both in atria and ventricle. Okay, and increases overall activity of the heart. Maximum stimulation can almost triple the heartbeat frequency and increase the strength of the heart muscle. So maximum stimulation, what will happen? It can also triple the heartbeat. So if the heart rate is 72, sympathetic stimulation is done maximally, it goes into 72 into 3, that is 3 216 times of heartbeat it can do. Okay, that is in normal people. Okay, that is the effect of sympathetic nervous system. So how does this mechanism occurs? Parasympathetic stimulation in previous slide we have discussed will lead to release of acetylcholine, where this acetylcholine acts and causes the decrease in heart rate and all. But in sympathetic nervous system, stimulation of sympathetic nerve endings release norepinephrine. What is it? Norepinephrine. In turn, this stimulates beta-1 adrenergic receptors, which mediate the effect on heart rate. Okay. So here mechanism is what? By release of norepinephrine. So you have to remember this one. Okay. Where this norepinephrine acts, this one will stimulate beta-1 adrenergic receptors, which mediate the effect on heart rate. Understand? Right. The precise mechanism whereby beta-1 adrenergic stimulation acts on cardiac fibers is somewhat unclear, but it thought to increase the permeability of fiber membrane to sodium and calcium. Here also again sodium and calcium. In parasympathetic we have seen there will be a exit of potassium ions in parasympathetic. So there is a decrease in heart rate due to more negativity. Due to exit of potassium, more negativity occurs. The resting membrane potential will increase, that is to -65. So there is decrease in heart rate and excitability is decreased in parasympathetic. But what happens in sympathetic? There is an increase in permeability of sodium and calcium ions. Okay, in the sinus node, an increase of sodium calcium permeability causes more positive resting potential. So in sympathetic stimulation, what is happening? The resting potential is becoming positive. But as in parasympathetic, the resting membrane potential is becoming more negative. Okay, so excitability will be difficult in parasympathetic, whereas excitability will become very easy because the resting membrane potential is becoming positive. Okay, it also causes an increased rate of upward drift of the diastolic membrane potential towards the threshold level of for self excitation. What also it causes? It also causes an increased rate of upward drift of the diastolic membrane potential towards threshold level for self-excitation, thus accelerating self-excitation and therefore increasing the rate of the heart rate. Okay. In the AV node and AV bundles, increased calcium permeability makes it easier for action potential to excite each exciting portion of the conducting fiber bundles, thereby decreasing the conduction time from the atria to the ventricles. See, this is a very interesting point. In the AV node, what is happening in AV node and AV bundles? This increased sodium calcium permeability, okay, this permeability, what is happening? Makes it easier for action potential to excite each succeeding portion of the conducting fiber bundles, thereby decreasing the conduction time. So this increase in permeability, what is happening? It is exciting the nearby conducting fibers also. So automatically the conducting fibers throughout the length are getting excited very quickly, okay, and thereby decreasing the conduction time for atria to the ventricles, from the atria to the ventricles. So what is saying, the impulse from SA node to AV node, from AV node to Purkinje to ventricles, that impulse will go. But in sympathetic stimulation, what is happening? The pathway, the entire pathway is getting excited, okay, due to this increased sodium calcium permeability in the heart, and the impulse is generating in each and every part of the heart. So the conduction time from SCA to AV, from AV to rest of the ventricles time will be very much decreased. Okay, so the heart rate on the whole will increase, the contractility and diastolity will occur very quickly, such that the heart rate can be tripled in case of sympathetic stimulation. That's what they are telling. Okay. See, easier for the action potential to excite each succeeding portion of the conducting fiber bundles. Okay, this is the reason. Understand? The increase in permeability to calcium ions is at least partially responsible for the increase in contractile strength of the cardiac muscle under the influence of sympathetic. So how the contractile strength of the cardiac muscle is increased during the sympathetic stimulation is due to the permeability of calcium ions. As we know, for the muscle to contract, we need calcium. Understand? To make actin myosin bonding. What is the main element we require? Calcium. So here calcium permeability is increased. So once the calcium permeability is increased, what will happen? The contractility of the muscle fibers will be automatically increased. That is what happening in case of sympathetic stimulation. Because calcium ions play a powerful role in exciting muscle of the heart. Understand? That's what it's telling. Okay. So finally, take home points. Sympathetic stimulation of the heart occurs by a chemical called norepinephrine, which in turn stimulates beta-1 adrenergic receptors, which mediate the effects of heart rate. So in people with high BP and all, we give beta-1 adrenergic receptor antagonists to decrease the heart rate, which acts against to the sympathetic nervous system. Understand? I mean, okay. Okay, this is a very important point. The main cause for this SA node excitability in case of sympathetic is increased permeability of sodium calcium permeability. Okay, causes more positive resting potential. It causes positive resting potential, whereas in parasympathetic potassium leakage will cause more negative resting potential. So there will be decrease in heart rate in case of parasympathetic nervous system, which is mediated by the release of acetylcholine, the nerve endings of the heart, mainly by the vagus nerve. Understand? In parasympathetic, the only now we discuss is vagus nerve, whereas in sympathetic now, the whole part of the heart is supplied by sympathetic system. So the excitability and the increase in heart rate will occur comparatively easier in sympathetic nervous system. Understand? By the release of norepinephrine once a sympathetic stimulation is done. Okay. So Sympathetic stimulation will give rise to positive inotropic effect, whereas parasympathetic will gives rise to negative inotropic effect. Inotropic means what? The increase in heart rate, that is called inotrope. Okay, so sympathetic stimulation gives a positive inotropic effect, whereas parasympathetic will gives a negative inotropic effect. This is what we have to remember finally. Understand? Thank you, friends.